So assessment-wise, okay? So move away from anatomy and physiology. We'll get to assessments. We'll talk about assessment, okay? I really think the aspect of keep it simple, all right, from that principles and all that stuff. And for paramedics, I push them all the time. They're like going, I want to do this, this, and this. I'm like going, go back to the basics, okay? Keep it simple, okay? You can't have good ACLS unless you have good BLS, okay? And what's good BLS? What did you guys learn last week? What's the first things that you did when you walk up to a patient? What's the first thing that you did last week? CPR. Okay. At CPR, if someone's unconscious, what's the first thing that you do? CPR. Before that, what do you do? Before that, check pulse. Before that, you want to scene safe. Okay. All right. Scene safe, responsive. Okay. All right. And we'll from the aspect of the Dr. ABC, okay? But it is, okay? ABCs. ABCs is a BLS skill. Airway breathing circulation is a BLS skill, okay? I teach my 12-year-old, where actually he was 5 when I started teaching him how to do CPR on his little lion, okay? That's what it is, all right? So it really is, keep it simple. All right, remember the basics. All right, initial, Dr. ABC, okay? Danger, response, airway breathing circulation. Okay, scene safe, level of consciousness, and don't forget your ABCs. Or for American Heart, switch it around to CAB because we go to the cardiac first. Okay, we don't really care. Okay, start with your history. Okay, sample history and all that stuff. Signs, symptoms, allergies, medications, pertinence. Okay, what's a pertinent? Someone's having chest pain. What's a pertinent history that you want to ask?
Something that's been happening currently.
Okay, something's currently. Yep, I'm having chest pain. What are you going to ask me? Okay, what? What were you doing? Okay, that's important. Yep, what else? What's some other history questions? How long has it been going on? Okay, what else? What does it feel like? Any previous surgeries? Why isn't surgeries important? Why is that important?
Blood clot.
Blood clot, yes, good job. Okay, strong work. All right, anything within the past 3 months? All right, what are some other questions you want to ask? Ever had anything like this before? Uh-huh. Uh-huh. What else?
I did listen.
Yeah.
Sometimes I listen.
Yeah. For females. Okay. Females in their teens, 20s, 30s, 40s. Menstrual cycle. Not important menstrual cycle, but what else? What do you females take that most males do not take? Birth control. Okay. You do have to ask, okay, for males, and I will ask males too, are you on hormone replacement therapies? Especially now with a lot of males that are transitioning to females and all that stuff. You got to ask those questions, okay? Because birth control does affect estrogen and clots and all that stuff, okay? So you got to ask those questions, okay? What were you doing? The aspect, do you get diaphoretic, get nauseated, do you feel short of breath? All those pieces. All right, good. All right, last time you ate, I don't care about that, and then everything leading up to that, okay? Complications, all right, or chief complaints. People will come to this. Did they pass out? Regular palpitations, chest pain, dyspnea. If you're an older female, meaning you're 65, 70, 80 years of age, what's the number one complaint that 65, 70, 80-year-old females have and they're having a heart attack? Good question, good thought. Yep. I like it, but no. Fatigue. I just feel tired. I don't want to do anything. I just feel tired. Okay, so you get a 60, 70-year-old female that says, hey, I'm tired. Okay, your spidey senses should go up. Okay, that's bad. Okay, and if you got a 70-year-old that says, I feel tired and they're diaphoretic, yes. Okay, bad you know. All right, blood pressures. Okay, from the aspect of your sigmometers. Have you guys done the sigmometers yet? Okay, so you understand the quarter cough sounds and all that stuff. Okay, quarter cough 1 and 2. So the first sound you hear is, okay, so the first sound you hear is the systolic. This is the quarter cough sounds. Okay, that's what the individual that found it. So you have the first quarter cough and the second quarter cough sound. The first quarter cough sound is your systolic pressure. The second one is the diastolic pressure. Let's relate it back to the heart. Okay, what is going on, or what are we kind of sort of, okay, resistance and all that stuff. Very good, okay? So as we're looking at vascular resistance and all that stuff, and sometimes this is some of the valves, and actually when we get to the murmurs and listening to all that stuff too, the lubs and the dubs in a second, okay? But our quarter cough sound is our blood pressures. 120/80 is deemed normal, okay? Okay. Is it normal? No, okay? Normal, okay, 120/80 was based upon normal of who? Okay, men between the ages of 18 to 22, 24 that were in the military, okay? They are fit. And actually it was Navy SEALs, I think is what the original information, all that stuff on, okay? So it's individuals that are fit and all that stuff, okay? So what do you need to ask when you're taking someone's blood pressure? Is this normal for you? What's normal for you? Okay, because if you have a little old lady that has a blood pressure of 90 over nothing, okay, and she's normally 180 over something, is that good or bad? That's really bad, okay? And you need to really do something or she's going to really die, okay, from that perspective. All right, so ask what is normal for them. Same thing like heart rates. If I have a patient that has a heart rate that's 105, 110, is this normal for you? Okay, because some people do live there. Mean arterial pressure, okay? Twice systolic plus diastolic divided by 3, okay? We use a lot of more of MAPs versus the systolic pressures and all that stuff, especially some of the medications that we give. When you guys get into paramedics and all that stuff with your epinephrine, norepinephrine, and drips and all that stuff, we use MAP pressures, okay? Our goal is above 65. Once you get to 50, you're into a shock state. Once you get below 50, you're in a really bad shock state. Okay, if your MAP is less into the 40s, no bueno, okay? So your goal is at least 65, okay? And it does factor into the aspect of how things go. Heart sounds, okay? The lubs and the dubs, okay? You all have stethoscopes? Okay, get a stethoscope. Go on to eBay and buy one for 19 bucks, okay? Go, get a stethoscope and listen. Okay, go to the nursing store, get a stethoscope. Okay, why? Okay, the more, and put the stethoscope on everybody. You're walking through Walmart and listen to everybody's heart. Okay, go, hey, free checks. Okay, stand at the building, put a sign out there and say free check. Okay, might not be able to tell them anything, but yep, that sounds okay. Thank you very much. That's a heart. Okay, but the whole purpose is listen, 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 listen. Because the more that you hear normal is when at time then you're going, that's not normal. You may not know what it is, but you can say, that's not normal. That's the key things. So the lubs and the dubs, okay? Systole, diastole, okay? So S1 is the lub, S2 is the dubs, and then we'll not worry so much about the S3 and S4 from that standpoint, which is getting into some of our murmurs and gallops. All right. So where do we listen? Okay. Again, we're listening to the valves. This is where the valves radiate their sound to. Okay. So APTM. Okay. Aortic, pulmonic, tricuspid, bicuspid. Okay. I was taught a long time ago. Don't know if it's right or not. Actually, when I was in nursing school, all physicians take money. Okay. That's kind of sort of the process. Okay. That's the piece. What? That is the Erb's point. This is kind of sort of they say that's the theoretical, like the point of maximal impulse is Erb's point, plus or minus from that. All right, so the second intercostal space, right, okay? So the right sternal at the second intercostal, that's where the aortic valve radiates to, okay? So if you think about where the heart sits, the point is where? The apex is to the left. The left hip. Okay. The apex is to the left hip. So the the aortic valve, okay, so the left ventricle, okay, is pointing down towards my left hip. That means that the opening to the left ventricle is where? Goes to my right shoulder, because that's the aorta. That's where it shoots the blood out towards to the right. That's where the aorta comes out of, to my right shoulder. So that's where you would hear at the second intercostal space the aortic semilunar valve when it opens and closes. Okay. Conversely, the pulmonic semilunar valve, okay, heart's rotated, so the pulmonic trunk is behind, it's in front of the aorta, but it points towards the left shoulder, okay, is where the pulmonic semilunar, so the pulmonic trunk actually points to the left shoulder and then it branches off. So the second intercostal space, midclavicular, or next, parasternal, okay, is the pulmonic. The tricuspid valve, where is the tricuspid valve? It's located between the
Right atrium and right ventricle.
okay. And how many cusps does it have? 3. And it has, what's the little muscles called? Guys remember? That's the ligaments, but what's the muscle called? That's the papillary muscle. Okay, so it's the papillary muscle that does the chordae tendineae. Good job. Okay, so the tricuspid valve. Okay, remember the right ventricle. If I were to stab you with an ice pick, the first piece of the heart I would hit is the right ventricle. That's why the tricuspid valve sits right into the center. Okay. And then the mitral valve is actually at the 4th or 5th intercostal on the midclavicular line. Okay, so down here is where you hear the mitral valve. So because the mitral valve, it's pushing down and all that stuff. Because the aorta squeezes, it pushes the blood down towards the feet.
That seems like a big space.
It is. Well, it's just the radiation. It's sound waves is all that you're listening.
Not the exact.
No, it's not the exact space. You're listening to west. That's where the maximal or the ideal location that you would have. All right. Tricuspid, 4th intercostal space. From that standpoint, mitral valve getting 5th intercostal directly over the left ventricle. And then this has the point of a maximal impulse is sometimes down there. Erb's point is again just the piece of that puzzle. All right. Clicks, MERBs, and all that stuff. This is a website you can go to. They have a whole bunch of things. Go there. Listen. Okay. Again, the more that you hear is abnormal, okay, and from that piece of it, okay. But listen for normal. Listen to normal. Listen to your friends, your children, your husband, spouse, wife, whatever, from that standpoint. Mom, dad, listen to what's normal, okay. So specifically when you're listening to the heart sounds, you're looking for the aspect of the S1 and the S2, which are the closing of your mitral and tricuspid valve along with the semilunar valves. Specifically in the S1, it's the lub of the lub-dub. That gives you the closures of your mitral and the tricuspid valves. Remember, those ones have the papillary muscles of the chordae tendineae, so they actually will help pull things open and they snap back, but it's still pressure driven. So from the atria coming down, the blood passively flows through, the valves open up, and then once the ventricle starts going into systole and they start pushing pressure upwards, they have to close those valves. If not, the blood would go backwards. So this is going to be heard by that first major sound. Conversely, though, the dub sound or the lub-dub, that's going to be the closing of the pulmonic and aortic semilunar valves. These is going to be between going from the ventricle and into either the pulmonary trunk or the aorta. And once again, once the ventricles start going into diastole, it's the very end of systole. Those valves, the pressure starts dropping down, and the blood starts pushing backwards from the aorta and the pulmonary trunk into the ventricles, and that's what snaps those valves back down. And it's that second sound that you're hearing